Hello everyone, my name is Aria Handlin and I will be doing my presentation on trauma responses and the key information and takeaways from this week. So first is the agenda and presentation rundown. First I'll do the introduction, then medical advancements, then the 4 trauma responses, 3 areas of the brain, 3 parts affected by stress and behavior impacts, 3 body systems, and meaningful and interesting material from the week that I took away as interesting, and a conclusion. So the medical advancements for how stress impacts the body. So there are various medical advancements in order to gauge stress in the body, including all the bodily systems at play. So there's the musculoskeletal, the respiratory, the cardiovascular, the endocrine, the gastrointestinal, the nervous and reproductive systems. These medical advancements are used to help with the following. So first, there's 7 in medical advancements. So first is the HRV heart rate variability. Then there's EEG or brain waves. Then there's breathing assessment via and through the use of capnometry. There is the adrenaline assessment. There's the skin conductance and skin temperature test. And then there's sleep tracking that can be done through apps. And then there's the resting heart rate versus the passive heart rate. And the purpose of these medical advancements is to inform public health initiatives, promote stress management, enhance management strategies, improve diagnosis, identify health risks. And the history behind this is that in the 1990s, the brain imaging really was a huge assistance to researchers in regards to studying how traumatic stress affects the brain as a whole, and as well as brain and development by performing the tests on psychiatric patients and those patients that had PTSD. So the first one is HRV, heart rate variability, and this is known to be a phenomenon psychologically in terms of time intervals between heart rates and heartbeats as seen here. And it is measuring your heartbeat through beat-to-beat intervals, and it measures the autonomic nervous system and the balance between sympathetic and parasympathetic nervous systems. Now on to the second one. The second one is EEG or brain waves. And this is called an and I don't really know how to say it, but this is what it stands for right here. And it is a type of test measuring the electrical activity happening in the brain through the use of small metal discs and electrodes attached to one's scalp, as seen in this picture. And these brain cells communicate through electrical impulses and are constantly active even when we are sleeping. The third one is breathing assessment, and this is through the use of something called a capnometry. And the capnometry is used to look out for the partial pressure of carbon dioxide, CO2, detection when exhalation is completed during the respiratory cycle. And the purpose is that it can be used for learning breathing behaviors for both relieving and preventing symptoms of asthma, sleep apnea, insomnia, headaches, panic attacks, anxiety disorders, hypertension, migraines, headaches, and allergies of any types. The next one is adrenaline assessment. And this is done through blood tests, urine tests, genetic testing, ACTH stimulation tests, imaging studies, and suppression tests. And the purpose of this is to evaluate and assess the overall health and functionalities of the adrenaline glands through diagnosis of adrenaline disorders, hormone balance evaluation, monitoring treatment response, preoperative evaluation, and screening for adrenaline tumors. The next one is skin conductance and skin temperature, and this measures the skin temperature surface and the electrical conductance of the skin. Skin conductance is used and done by placing electrodes on fingers and palms as seen in the picture above. And skin temperature measures the thermoregulatory processes of the body by environmental factors of blood flow and environmental conditions as seen by the picture below. Sleep tracking is the 6th medical advancement, and this is a device monitoring a person's sleep. And there's environmental devices and apps that are better, and they are proven to be more effective. There's also, the last one is resting heart versus passive heart rate. So it looks for a normal heart rate for adults, which is between 60 to 100 BPM, which is beats per minute, and the lower the better for a resting heart rate. And as you can see in this chart, it's developed by age of men and age of women. Now on to the 4 trauma responses, the main ones, the 4 Fs. So there's fight and flight, and then there's freeze and fawn. So the first one is fight, and this is usually mainly affected by the sympathetic nervous system, and it has symptoms of irritability, anger, aggression, and moving forward and toward. And then there's flight, which is usually mainly affects the sympathetic nervous system, has symptoms of anxiety, fear, panic, chronic worry, perfectionism, and a behavior that I engage in, which is wanting everything to be perfect. And this allows for assertiveness and solid boundaries by maintaining power and control over the threat at hand. And with the dangerous situation at hand, this usually corresponds with avoidant behavior to escape the threat that's at hand. The next one is freeze, and this usually affects the dorsal vagal area. And this has symptoms of feeling stuck, collapse, immobilization, spacing and zoning out in social situations, disassociation, depression, guilt, and shame, and anxiety. And this helps one to slow down in order to carefully think of the next steps at the perceived threat at hand. But then when the situation becomes overwhelming, then one has a neurological shutdown and they freeze. And that's when a freezing happens, is when they shut down. Then there's the fawning, and that's when individuals have people-pleasing tendencies. They avoid conflict in any social situations with people. They prioritize others' needs over their own. They have difficulty saying no and setting boundaries, which is very difficult for them. And as someone, I actually have a difficulty with this as well. The next one is the 3 main areas of the brain, the triune brain, and all 3 parts are needed for survival, for safety, connection, and problem solving. And the brainstem purpose and role is highly needed for a survival state, and asks whether individual is safe or not as representing the primal brain and creating an illusion for soothing and for the illusion that safety is present. And so there's 3 parts of the brain. So the first one is reptilian and lizard brain stem and cerebellum, and the purpose and role is that it houses and stores the survival instincts and manages autonomic body processes such as breathing, hunger, thirst, heart rate when it is on autopilot, survival, and fight or flight mode. Then there's the mammal brain, and this has the purpose and role of housing and storing the attachments of others, the emotions and memories from the experiences, and the habits that are formed over time. Then there's the human brain, which is the neocortex, and it is in charge of creativity and imagination, abstract thought, thinking, language, and comprehension, consciousness, reasoning, and rationalization. The 3 parts of the brain are affected by stress. Now the next part is the 3 parts affected by stress and how behavior is impacted. And the purpose is to regulate emotions and respond to fear. The amygdala becomes hypersensitive to emotions and fears responses and emotional reactivity, and it is in charge of taking action to protect us and ensure our safety through the fight or flight activator. And it responds to threats faster in comparison to the prefrontal cortex. And the role is it does not go offline after trauma, but it becomes overwhelmed, overactive, and oversensitive. And if it is overworked, then there's heightened levels of anxiety, high alert all the time, making you feel on edge, and more likely to exaggerate emotional cues. If it is overactive, then there's chronic stress, heightened fear, inability to calm down, increased irritation, and insomnia. The second part is the hippocampus, and this has memory difficulties leading to malfunction of memory formation and recalling what had exactly happened. And damage can specifically affect spatial memory or the ability to remember directions, locations, and orientations. And the last one is the prefrontal cortex, which is an impaired emotional regulation and decision-making due to the prefrontal cortex, which reduces activity and connectivity, leading to making sound decisions and controlling impulses and impulsivity. And Prefrontal cortex also tends to ignore distractors, disrupt the ability to specifically focus on the relevant stimuli, and damages that can have blunted emotional responses. The respiratory system is how oxygen is supplied, and it removes CO2 from the body, and it's how stress is demonstrated through shortness of breath and rapid breathing, as seen in this picture. The cardiovascular system is chronic, and long-term stress can lead to increase in heart rate, stronger contractions in the heart as a muscle, stress hormones as being the messengers, and it can increase the risk for heart attacks and strokes, and for hypertension as well. And the last system I chose was endocrine system. And cortisol has the main function of regulating metabolism and the immune response. And if long-term effects after stress occurs, then it results in both physical and mental health disorders and conditions such as depression and anxiety. And lastly, meaningful material from this particular week was, I did not know that we could have the ability to change our brains despite them having exposure to traumatic exposures. And I also did not know that chronic stress affects men and women differently in their reproductive systems, and moreover depends on the gender of the individual by being affected by both toxic and traumatic stress. And lastly, the history of trauma was really cool to learn about, and I did not know that trauma was the Greek word for wound, and it refers to emotional wounds and physical injuries when we talk about trauma. And also, I did not know that French neurologist Jean-Martin Charcot both defined and studied hysteria. And I appreciate you all for listening, even though this was a little long.